our Executive Director, Tim O'Connell, who will bring greetings. Tim?
Hey, good afternoon, everyone. It's good to see you today and see you here in the Zoom world. My lunch is coffee. I'm not sure if you can see that, but having a good coffee here with you all. So excited about this program. When I heard Daryl mention this, my first job ever at 14 was working in a retirement community, and I really began to understand just the different stages of life at that point. I went on to work for the YMCA, and there I actually ran Silver Sneakers programs. And I saw the power of community when people came together. And I'm so excited about this, just beginning the conversation on this topic. I think it's so important. And it's not just a topic for older citizens and people of North Carolina and elsewhere. It's also just a topic, you see this in the research, for young people as well. So this topic is a really important one I would say, for today and for any day, for our communities and for our country. You know, when we're closer together, we're connected, we're stronger. So I just thank you all for joining us. And I believe we've got Mike Taylor here, our board president. And Mike, would you like to say a few words?
Sure, Tim. Can you hear me?
Yes.
Good. Thank you for allowing me to join you today. As I told Daryl, I've certainly felt the need to be involved with a Zoom that was attracting as many people as this one has. It's been my honor and privilege to be president of your association for the past year. And July 1 will mark the beginning of my second and final year as your president. I'm reminded, with this many people turning out, a great baseball movie that I've always enjoyed was Field of Dreams. And it's about a mythical baseball field in farm country in Iowa. And I think it's James Earl Jones that says, if you build it, they will come. Well, I think this is a great example of, Daryl, that if we offer programming and we offer programs and we offer services that our members want, then they will indeed come, as they have signed up for this Zoom. So knowing where we came from about a year ago, when we could have a Zoom and you could fire a cannon off and not hit anybody, the attendance was pretty sparse. And today, to have this kind of turnout, I think it just echoes that. If we build it, if we put it together, if we offer it, then our members are interested in doing that. And that makes it important for us to continue doing that. So I want to applaud Daryl for all of her work with the local advisory groups and in organizing and pulling this together. And thank you all for attending, and thank you all for being members of the largest retired civil servant association in the country, UNC-Charlotte. Daryl, back to you.
All right. Thank you so much, Mike. We appreciate you being here. And thank you so much, Tim. Now, let's get started. We have a full program for you. Please use the chat for your questions and comments. If you don't know where that is, that's at the bottom of your screen. That's at the bottom of your screen. And you can, if you don't see chat, click on more, and then you read the listing, and it will be a chat there. And you'll see chat on the side of your screen. So please use that for questions and comments. This afternoon, I will serve as the moderator, and Patty Dukes, NCRGA's digital content manager, will serve as the moderator for the chat. Thank you. Thank you for coming. I will now begin to introduce our panelists. So thank you, Rebecca Freeman, who works for the North Carolina Division on Aging and Adult Services, assisting division leadership with many new initiatives. She also serves as staff liaison to the division's 2 legislatively authorized advocacy groups. Her career began at the local level, working primarily with senior centers. She earned a Bachelor's of Arts degree in psychology from East Carolina University and a Master of Public Health with a concentration in health policy and management from the University of North Carolina at Chapel Hill. She is passionate about helping older adults remain active, engaged, and filled with a sense of purpose. Rebecca, I'm gonna try to get your picture up. I couldn't do that while I was talking. I'm sorry. So this is Rebecca. All right, so thank you. And then thank you, Dr. Cheryl Greenberg. Cheryl, raise your hand so I can spot you. Okay, there you are. All right, that's what I should have said to Rebecca. All right, Dr. Cheryl Greenberg is a life coach for seniors and their families who are in transition, whether they are seeking new directions or navigating health-related changes. Cheryl's doctorate focused on adult development and memory improvement for older adults. She has worked as an educator and administrator in a number of schools, including the University of North Carolina at Greensboro. She currently speaks and writes about healthy aging and volunteers for organizations that support seniors, such as AARP, the Alzheimer's Association, Adult Children of Aging Parents, and the Triad Retirement Living Association. Again, thank you, Cheryl. Next, we have Dr. Megan Smith. And I'm gonna pull her up, highlight her for everybody. She is an assistant teaching professor of sociology and the undergraduate coordinator of the gerontology program at the University of North Carolina at Charlotte. Her teaching and research interests are in the areas of mental health, loneliness, and deviant behavior. And she presents on the topic of loneliness and social isolation in older adults regularly. She may have been doing that just before coming on board with this program. She has co-written a book, Ties That Enable, Community Solidarity for Adults Living with Severe Mental Illness, published in 2021, and has a forthcoming textbook entitled Sociological Insights on Mental Health and Distress, to be published in 2024. In addition to her academic work, she serves as president-elect of the Junior League of Charlotte. And in her additional time, I thought this was really important, she teaches needlepoint at the national level, travels and spends time with her family and friends. Dr. Smith, Megan, please just take this away.
Wonderful. Can you hear me?
Now we can turn it up just a little, maybe.
Mine is on full volume.
Okay, it's good.
Okay. Hi, everyone. So my name is Megan Smith, and I will be starting the Aging Unlonely. I'll be the first person to speak. If we can move to the next slide. So my responsibility in the webinar, and definitely my pleasure, is to provide some context about the current state of social isolation and loneliness. We've been hearing about it for a while, but in fact, it's been in existence. We know that social isolation and loneliness have been on the rise for at least the past 4 decades. Research has shown us that. So in the late 70s, the magic number of people that typically had better health outcomes were people with whom they could talk to about anything was about 5. And then in the 1990s, that number decreases. And in the aughts, which would be the first decade of the 2000s, we're noticing that large proportions of our society have 0 to 1 people with whom they can talk to about anything. If we're going to look at a silver lining of the pandemic, one of those is that the conversation about social isolation and loneliness has moved to the forefront, because we know it was an issue prior to the pandemic, but there can be a lot of stigma associated with it, meaning people just don't really want to talk or admit that it's happening. So the reasons why we're seeing this rise in loneliness is because we have an increased life expectancy. We are living in the age of chronic diseases, meaning you can live with diabetes, heart disease, to high blood pressure for decades due to medical interventions, advancements, and pharmacology, just meaning medication. We know that loneliness increases because travel is easy. So families are no longer staying in the same cities or communities. They're moving across the country for jobs. One of the biggest contributors to this loneliness over the decades has been financial independence at multiple points in people's lives. So not just older adults, but also young adults as well. And then, of course, technology use. The rise of social media seems to be creating a little bit of a social disconnection for certain groups. In 2015, Dr. Murthy, who is our current Surgeon General, was appointed Surgeon General under the Obama administration, and he and his team traveled around the country. And in short, basically, he thought, I'm going to hear that people want to talk about cancer and obesity. He said, for sure, that's what I thought. And then it turned out that people really wanted to talk about being lonely. And it did not matter whether people lived in rural areas, suburban or urban. This was a constant thing that people were talking about. In fact, he wrote a book that came out in 2020 about this very thing. So at that time, he declared it an epidemic, but I don't think that people were really paying attention. It was the end of the administration. And then we were also seeing a rise in the opiate usage, which did deserve our national attention at the time and continues to do so. But in 2023, he decides again, a lot of research is coming out about the effects of loneliness and social isolation on our health and our health outcomes. And so it is declared a public health crisis. So we move from an epidemic to a full out crisis. And the Surgeon General's office, meaning Dr. Murthy's office, has written a very accessible document about the causes and consequences of loneliness and what we can do and what the federal government's plan is to try to alleviate the burden of this on individuals, community, and our society at large. Next slide. So just to give definitions, because I'm sure that you've heard social isolation and loneliness, and a lot of people say, well, what's really the difference? Social isolation is the quantifiable lack of relationships or infrequent social contact. So that's our objective count. I can give an example. In the United Kingdom, they had a very serious problem with loneliness. They instituted a role, the Minister of Loneliness, and they have really good data. And basically, what they've discovered is over 56% of their older adults are not seeing individuals for 5 to 6 days on end. They have many rural areas in the United Kingdom, which makes that a special condition. But I would imagine, we don't have quite as much data, but we can definitely say around 30% of older adults are experiencing isolation for sure, meaning they're simply not seeing people. And the reason for this might be they live in rural areas, they don't have the ability to have transportation available to them, they can no longer drive. But this can happen in urban areas too, and that can be based on not living near family, neighborhoods that have high turnover, meaning the neighbors move in and out a lot, and so you don't know people. That can be causes of this, in the situation around social isolation. When we talk about loneliness, I'll get to this point right now, Kathy, it's a great one. For loneliness, it is the perception of feeling that you do not have the meaningful number of relationships that you would like versus the ones that you actually have. So if you are a more introverted person, you still need people, but maybe you need 3 people. So if you have 3 people, then you do not feel lonely because you have these 3 meaningful relationships. And maybe you don't see them all the time, but that is meaningful to you. But if you only had 1 person because maybe 2 of them were family members and they moved away, you would likely feel lonely. I'll give myself as an example. I'm an extrovert. If I don't have 30 people on speed dial, I feel lonely if I only have 20. So it's this subjective feeling, and we all have different bars or measurements of what loneliness is for us. So that's also a kind of a confusing factor in that there cannot be a clear definition, except to say there is a mismatch between the type of quality relationships you have and those that you would like to have. We know that social isolation is a significant risk factor for loneliness, and the feeling that we want to have more contact with social partners, whether that is coworkers, family members, neighbors, people in civic organizations, religious organizations, etc. Next slide. All right, so we know that about 50% of US adults feel lonely. That could be slightly skewed to the fourth point, which is that Gen Z is reporting very high rates of loneliness. It's very concerning, actually. 61% of people who belong in the Gen Z age cohort are identifying as being lonely. We ask people a series of questions. So we use an assessment called the UCLA loneliness scale, and usually that would just come in a survey. We know that 43% of adults aged 60 plus feel lonely. So that is a very large amount of people. And it doesn't necessarily, this does not capture people who are socially isolated. So loneliness can end. Even though it can be chronic, it can end once those relationships change over time. So what increases the likelihood of loneliness? Oh, Gen Z. So that would be individuals probably between the ages of about 17 to 26, somewhere in there, people that are late high school, college, and early adults, young adults. There are a lot of programs that are trying to connect college age students and young adults with older adults. The age integrated networks seem to be a real win-win for a way to solve this issue. Increasing the likelihood that you will be lonely is living alone, mental or physical impairments, limited social support, meaning people around you that can support you emotionally, physically, and then those who are discriminated against chronically or even in certain settings based on age, racial or ethnic identity, sexual orientation, and gender identity, and language barriers. Next slide. So what are the impacts on our health? If we identify as lonely, research has shown that people who are lonely, so they answer yes to all these questions, or at least a number of them that say, yes, I feel that I don't have the relationships that I would like, no matter the reason, we tend to see the following: higher rates of blood pressure, larger proportions of that population that reports being lonely. Anxiety. We know that people who are lonely are four times more likely to be depressed. So if you're lonely, you are not automatically depressed, but if you are lonely, your risk factor for being depressed is higher. We see cognitive decline, higher rates of Alzheimer's for social disconnection, higher rates of cancer. People tend to have lower life expectancies. So the famous kind of line right now is that being lonely is like smoking 15 cigarettes a day in terms of your life expectancy. What they're saying is that people who are lonely, being lonely is really detrimental to your health. And so having those social connections should be part of your health plan for your entire lifespan. We see weakened immune systems, so people get sick easier, and then obesity. So that is my portion. Oh, that's my portion, and I believe that Rebecca is going to join us now.
Great. Thank you so much, Megan.
Yes.
And I want to ask that if there's any questions that pop up into the chat, one of my colleagues share those with me, because I'm worried about managing the screen and the slides and the chat. So one of the things that we've learned and we think is really important to highlight is that not only does social isolation and loneliness have an emotional or a health impact, it also has a financial impact to our nation. AARP in 2017 published a study, and you can see here that social isolation was even more costly to the Medicare recipients than arthritis, not far behind high blood pressure. In fact, it was estimated that it cost Medicare an estimated $134 more per person monthly, which equates to $1,608 annually. And with the inflation we've had in the last 5 years, I can imagine that's gone up quite a bit. In total, the study estimated that a lack of social contact among older adults is associated with an estimated $6.7 billion in additional Medicaid spending. So when we try to talk to funding decision makers, elected officials, et cetera, sometimes they need to know about the return on investment for funding certain initiatives. So I would argue that initiatives aimed at addressing social isolation and loneliness is actually a potential cost saver to our society. Back when the pandemic first began, the Suicide Prevention Resource Center published a one-page document that was pretty easy to follow, and then a little bit of a longer brief to talk about how to reduce loneliness and social isolation among older adults. And I thought this was really practical and something that this group may appreciate seeing. And these slides will be provided, and you'll have the link. So if you want to read the full document, you will have access to that. But it's basically saying that there are 3 steps that if you're concerned about social isolation and loneliness and you're around other older adults, that you may choose to do to assist them. So the first is, 1, just recognizing that it could be an issue. Consider that they may be lonely or socially isolated based on their life situation and risk factors. And don't wait for them to tell you. You know, if you think that that's an issue, perhaps you ask them, do you feel lonely and isolated? Secondly, if you suspect that they're possibly lonely, assess the individual using the UCLA 3-item loneliness questionnaire or another brief tool. And in a little bit, I'll show you where you can find that assessment tool online, and you could even take a self-assessment. It could also be part of a routine medical screening. And third, if an individual is lonely, you need to try to understand why using an empathetic, non-directive, active listening approach. So some possible reasons: it could be that they're socially isolated. It could be that they limit social skills. They have low social support. They have unhelpful thoughts about social situations. And so you want to connect those individuals to resources that would be helpful for addressing that root cause of the loneliness. So you would want to inquire about and acknowledge the individual preferences of the individual. And I will just go one more slide. So again, this is just a different way of looking at the same information. So once you get down to the understanding the cause, if it's social skills that's an issue, you know, there's different things. There's online social skills training. There's psychotherapy focused on social skills building. If the issue is increasing social support, maybe friendly visitors, if there's a program in your area, virtual connections or groups, visiting the local senior center, in-home social service supports. If it's access to social interactions, some potential interventions could be telephone outreach, online chat, assistive devices, social activities, and even transportation assistance to help people get to where other people gather. And then finally, if the issue is unhelpful thoughts about social situations, perhaps cognitive behavioral therapy and even mindfulness meditation has been shown to be effective. And so with that, we are going to move to our panel discussion.
All right. Thank you all. Thank you, Megan, and thank you, Rebecca, for setting this up. My first question goes to Cheryl. Cheryl, we know that research suggests that isolation and loneliness are a problem for many older adults. Do you see this in your day-to-day work with these individuals, and how frequently do they talk about being lonely or wanting more social outlets?
It's a good question. You know, in my work as a life coach and for seniors, and when I make presentations for organizations like AARP, I am sometimes approached by people who have had life changes. They've moved, they've retired, maybe they've lost friends or family members. And they say they feel lonely and disconnected, but they don't know what to do about it. And so for them, it's not recognizing that they're lonely, but figuring out new skills of integrating themselves into the community and finding social activities. More often, though, a client or the client's family, a senior or his family, notices that the older adult is sad or at loose ends, they're satisfied, maybe they're grumpier than usual or agitated, and they don't really know the reasons why these changes are happening. And it's a change that we're looking for, not this is how the person has always behaved. The older adult may feel more dependent on family and friends, doesn't know why, maybe just thinks it's natural as they get older. Often what's really happening is they're missing social connections. And it takes some time for them to see that that's what's causing the changes in their behaviors. And then we can find opportunities for them.
Okay. Thank you, Cheryl, for that answer. Rebecca, please tell me about what makes you so passionate about this issue. Or similarly, what experience do you bring to this issue?
You know, it's interesting. When I worked at senior centers, I grew very passionate about senior centers. And when I had the opportunity to start working at the state, I would tell my friends and my family that I work with senior centers and I love it. And I felt like people didn't really get it. Like, why are you so, I mean, at that time I was only in my early 40s. Like, why are you so obsessed with senior centers? So I have to kind of reflect back. And one of the things that I think about is, you know, I started out in Wake Forest at a very thriving senior center where lots of people came. People came in public transportation. People came in their Lexuses. There was a lady who used to wait at the door when I would go to open it, and she would tap her cane. She used a cane, and she would tap it on the ground when I walked up. If it was 2 minutes before 8, and she would yell at me, "You're late." And it used to make me so mad because I was stressed out trying to get to work. I knew I was running late, but looking back, I know now that the senior center was really all she had. She was really lonely. She had lost her husband, and coming there, you know, made a difference. And then when I got to the state level, I got to go to senior centers all across North Carolina, and I really saw what a difference they made. But then in 2017, we did a survey because we've been trying to get more funding for senior centers for years and years, and unsuccessfully. The General Assembly hasn't given a big increase in a very long time. And so one of the things we thought was important is to get some outcome data so we could tell the story, we could sell why senior centers made such a difference. So we did this big survey. We had over 7,000 participants from across the state answer. And across the board, you know, we saw that senior centers made a huge difference in a variety of things like access to fitness and advocacy and volunteerism, and of course, less isolation and loneliness. But we also asked people to respond, you know, anything else they wanted to add about what the senior center meant to them. And I will tell you, some of the testimonials were really hard to read. People said that if it wasn't for finding that resource, they would have ended their life. We heard that. So I just became really passionate because it touched me knowing that these people exist and knowing how important engagement is for them.
Right. Thank you for that, Rebecca. And that's one resource that our people on the call can use. So Rebecca, you mentioned the finances with the Division of Aging, but what has the Division of Aging and Adult Services been doing to address this issue? It's so big.
Sure. And I know you said we have just a couple of minutes for each question. So this is the one I'm going to spend a little bit more time on because we've been doing a lot. I want to say before the pandemic, the Aging Network, so the division, area agencies on aging, senior centers, other providers, for many years have been doing a lot to address social isolation without necessarily calling it that. We have senior centers, we have congregate nutrition sites where people go to have a meal with other people. We have caregiver support groups, home delivered meals for people who can't get out. It's more than a meal. They have that. Sometimes it's the only person they see throughout the day. So there's a lot of other supports that have existed for many, many years. But when the pandemic began, you know, I immediately was very, very concerned about our participants of senior centers and congregate nutrition sites. So we formed at the division a social isolation work group back in April of 2020. So we did several different things, and I'll touch on each of those very briefly because I could use this whole hour for a presentation on it. First, we were connected with 2 researchers from other states who were very interested in this issue. And with them, we did a survey of our providers, our area agencies on aging, and basically asked, is this a problem? Are you seeing it? How real is it? What do you have the capacity to address it? And not just social isolation, mental health issues, suicide. And so we, of course, found out overwhelmingly that, yes, they were seeing it. Yes, it had increased since the pandemic. And no, they didn't have the resources. They didn't feel they had the resources to address the issue. So along with that, we continued to work with those two researchers who were developing, they were funded by the Administration for Community Living at the federal level to develop a evidence-based approach to addressing social isolation and loneliness. So they've developed this program called the B training. It's B stands for belonging and empathy. So the belonging and empathy training. And it's a phone-based program that providers can use to reach out to people who are potentially lonely. And it's based on the premise that all people need to belong, and that empathy is a skill that helps people feel like they belong, and that empathy can be taught. And so we offered the B training, but there's a second portion of that. There's a real link between social isolation, loneliness, and suicide, elevated suicide risk. So we coupled the B training with the ASSIST training, which is the applied suicide intervention skills training. So we offered throughout our network the opportunity to participate in the B training and the ASSIST training, and had 67 people throughout the state trained in those skills that work in our network. We're anticipating to do another round of those trainings in August of this year. So that was the first thing that we have done. The second, we hosted 2 graduate students. They were getting their master's in public policy from Duke University, and we did we were their host for their capstone, and they did a big cross-departmental assessment of what was being done, and also did a nationwide assessment, and put together a report with 3 recommendations to the Department of Health and Human Services. And in that report, the recommendations included incorporate screening for this in your standard screenings that you do, fund pilots that are aimed at addressing this initiative, and then also to create a task force focused on this initiative. So that report was submitted. I have not seen any action on any of those 3 recommendations, but it was something that we are proud of. The third thing, we funded a program called Trualta. And if you are a caregiver and you've never heard of Trualta, I encourage you to look it up, Trualta. That is an online caregiver platform, because caregivers are especially at high risk of being isolated and lonely, because they are under so much stress sometimes, and using all of their spare time to help help their loved one. So we funded the Trualta online virtual program. Right now it's available at no cost for any caregiver in North Carolina. And there's a lot of education, but there's also a social component where people can connect with other caregivers. We helped initiate the Healthy Aging Task Force, and one of the 4 buckets, and that was through the Institute of Medicine. So one of the 4 buckets that the task force looked at as what is involved in healthy aging was social engagement, social isolation. And so there's a report due to come out in August or early September with those recommendations. They will be submitted to hopefully the General Assembly, the governor, DHHS, secretary, etc. And there are some very specific recommendations for this topic in that task force report. I had the privilege of getting to write an article for the Institute of Medicine North Carolina Medical Journal on this issue, and I'll share that link in the chat when I'm finished talking. So we highlighted the issue there. We received a ton of pandemic relief money. So our area agencies on aging and others in our network purchased animatronics for people. They're robotic pets. They've been shown to be moderately effective with people with dementia for helping them feel more connected. Our area agencies and others bought tablets for people so that they could get connected virtually. And some are also providing some digital skills training. We instituted a requirement for senior centers of excellence. We have a certification program for senior centers in North Carolina. And if a senior center is a certified senior center, they are now required to offer virtual training. And we've continued that beyond the pandemic, knowing that there are many people for one reason or another can't or won't go to a senior center, but do need access to that same type of social engagement. But we know that not everybody has the same skills with computers and technology. So we also applied for and received a $1.12 million digital equity grant. And we are going to be rolling out some digital literacy training for older adults specifically in the coming next 2 years. And then finally, I want to share just one resource with you by sharing my screen. So give me just a minute to pull this up. Let's see, first I gotta get the screen loaded and then get back to Zoom. Okay, this is gonna be just a little tricky. Okay. Do you all see a Healthy
Yes.
Aging NC website? Okay, great.
Yes.
So one of the big things we did, and this is an ongoing project, is we partnered with Healthy Aging NC, and that's healthyagingnc.com. You can all go visit it to build out some social engagement resources. And I just want to take you through a couple of those. So if you click on this, you can take yourself, as I mentioned earlier, the Lubin scale, which looks at your social network, how many people you have and how isolated you may be. So I'm just going to take this so you can see how it works and say, I'm really lonely. I don't have many people that I talk to at all, whether it's family or friendships. I'm just going to say none for everything. And once I take that, you can see the results should come up. My score is a 0. And it says here that social isolation may not be problematic for you, but it can sometimes lead to, I'm sorry, the first thing tells you the score. So it says I could be at risk. Okay, but then there's also the loneliness assessment. And so that would also, you can link to that from the website. And then here is where you get to what Megan was talking about, the actual subjective feeling of loneliness. So how often do I feel that I lack companionship? Often. How often do I feel left out? Often. How often do I feel isolated from others? Often. And so once I get that, it shows here that my score was a 9, and people with scores of 6 to 9 are lonely. And then it connects people with social engagement resources. It also provides a way for people to be contacted if they want to receive some support. So I'll just share just a few of the resources and then be finished. So our area agencies on aging, libraries, cooperative extension, there's a social bridging program out of UNC Asheville, health promotion, senior centers. And I want to click on that one because if you're not familiar, we have over 165, there's more than that now, senior centers in North Carolina. So you can just put in your address. Let me just put this in. You all can all send me money now that you've all seen my address. So, and it populates a map and then also shows you the different senior centers that show up that are closest to you. So we're really proud of that. The last thing I wanted to show you is that we are working to develop an online one-stop shop for virtual events. And Daryl, if you continue these lunch and learns, your events could be advertised on here. Senior centers could advertise, cooperative extension, so that older adults can come to this place and find virtual events statewide.
Wow.
Thanks for letting me go on and on.
Rebecca, thank you. There's so many resources. Please, you put this in the chat and then send it to me as well. And we'll put it in the follow-up email. So now I want to move on to Cheryl. Can you share a little bit about what AARP has been doing to address this issue?
Certainly. AARP is just one of the many resources that we have for getting socially connected. But since I'm representing them today, let me tell you a little bit about what they do. If you were to go to the AARP website, aarp.org, you would find all kinds of information, both the kinds of things you've been hearing about today, sort of the background about isolation, socializing, why staying socially connected is important for your brain health and your health of your body and the length of your life even. So you get that sort of background information. But you would also find information about specifics, like really specifics, like how do you increase your social interactions if you are basically a shy person or thinks you have a social anxiety? How do you deal with that? What does that mean? Or how to stay connected. We heard about this today. How to stay connected if you're caregiving. If you're a caregiver, by definition, your time becomes limited. And we have a tendency as caregivers to then give up those social connections that we need for our health. So tips on how to move into a retirement community and get to know other people, very specific stuff. There's even a lovely video on the website about a woman who goes out into the park in New York City. She meets a mime and asks him questions about what he's doing, and they form a friendship. So it's down in the weeds, detailed stuff, and the broader, more academic stuff. At a more granular level, though, and actually maybe in a face-to-face way, there are a lot of activities for people to get to know each other and to socialize as part of AARP. We have something called Movies for Adults. You go to a free movie, you socialize with the people who are there, you greet the volunteers and get to know them, they ask you to be a volunteer. It all is very circular and engaging. Now, the one thing I want to leave you with in answering about AARP is probably the most important way you can socialize for AARP is become a volunteer. Become a volunteer, because you will be doing two things at the same time. You will be doing something that contributes to the welfare of the 50-year-old, what we call the 50-plus community, but you'll almost always be doing that with other people. So whether you're like me and you're doing diversity training or giving talks to groups, or you're at a tabling event, you know, you're a greeter at the Coltrane Jazz Festival, you're with other volunteers and you're face to face with the community, doing something that creates a bond. And by doing something with somebody else, you can find the socialization sort of follows along. You don't have to start by socializing and finding a game to play or a sport that's interesting. You can do the sport or play the game or volunteer, and that brings you in the other direction to socializing. So there are myriad volunteer opportunities, and you can also sort of sign up, see them online, and then sign up to be part of the community. That's a fast overview of AARP.
Yeah. So, Cheryl, what do you see as the major impediments to older adults being more socially active?
Oh, as I said earlier, it sometimes takes a certain amount of curiosity and self-examination to see that a person needs to socialize more, right? Somebody may just retire, move, as I said, these are examples I used before, have a friend move away or lose a spouse, and they, you know, in the moment, as they are experiencing that change, they may become less active, less connected to people. And instead of going through the grieving process or going through the adjustment process and getting back to activities, now they have fewer activities, or they become more used to this isolation. It becomes normal for them. They gradually decrease their contact with maybe not even noticing it's happening. And so I would say that is one of the really big problems. There's another problem, and I want to just lay this out for you to think about. Ageism is a problem.
Mm-hmm.
It's a big problem. Yeah. We don't talk about it much. We talk about racism and ethnic differences and so forth. But ageism is a problem because we often say to ourselves, I can't do that. I'm too old. What will they think if I go to that book club meeting and I'm the oldest person there? And the reverse is true. Sometimes people put us aside as we get older and say, I don't really want her on my committee. You know, she's old. What does she know? I mean, the next person who asks me if I know how to use a computer is probably going to hear something from me. So I think there's a real need to, number one, recognize if things are slowing down for you in terms of contact. And the second is to notice your skills and your interests and your capabilities and put yourself out there so that you do stay connected.
All right. Thank you, Cheryl, for those comments. And I'm sure, if you will, would you put something in the chat maybe where people can contact AARP, if it's just aarp.org or however it is?
I will do that, and it's aarp.org, or you can call me or email me and I will set you up.
All right. If you don't mind putting your email address there,
I will.
that would be great. Rebecca, where can people learn more? I know that you shared your website. Is there any other idea that you might have about where they can learn more about how to socialize or where to go to socialize?
Sure, but can we back up just a second, because we had a question that I was going to talk a little bit more about ageism, and since Cheryl just brought it up, I wanted to make sure that I touched on that just a little bit.
Okay.
So ageism, some people don't recognize that as an ism, but the World Health Organization has officially recognized it, and they have provided a definition of ageism, which is stereotypes or how we think, prejudice, how we feel, and discrimination, how we act toward others or ourselves based on age. And I appreciated that Cheryl mentioned, kind of that inward ageism that occurs. So older adults can be lonelier because they experience loss, but also because perhaps they don't feel like they're a valued member of society. Another really important thing is that the medical community sometimes can dismiss concerns of older adults. I'll give you a really sad example. Suicide rates in older adults is among the highest, if not the highest. And oftentimes that's just the ones that we know, because oftentimes medical providers or family members dismiss a death as just a natural part of being old, and when it actually was a suicide. So, and I also want to say that, we worry some that decision makers, elected officials at the local and state level do not prioritize the needs of older adults. But I wanted to make y'all aware that the governor, in his proclamation for Older Americans Month in May this year, he did talk about ageism. So I thought that was a really bold move on his part. And I also want to mention that the governor has initiated, on May 2nd, 2023, he signed Executive Order 280 into law. And that was calling for North Carolina to become an age-friendly state, and also to develop a multi-sector plan for aging. And so we have just recently launched All Ages, All Stages NC. It's our multi-sector plan on aging, and we're going to look at all aspects of what it takes in North Carolina to make it a state where people that are older feel valued. We definitely are going to have an emphasis on addressing ageism as well. So Daryl, I'm not sure if Cheryl covered the next two bullets, and so you were skipping ahead for that, or if you want me to go ahead to the last question as well.
One of the things we wanted to do was give people some ideas about where they can look for new activities. Is that what you're talking about?
That's where we were going with that. What are the few activities that they could do? Yes, please. Either one of you could. Cheryl, why don't you start with that? And Rebecca, if you think of something else, and pipe in, or Megan.
Rebecca, if you would put the slides up. So I'll get started just to tell you about this. I know that a lot of what we have said has created for you, the participants, lots of information about why it's important to be socially active and some of the impediments, some of the barriers. But the bottom line is, as I said before, people come to me, they stop me after presentations because they say, okay, I'm lonely, but I don't know how to take the next step. When I first started to address this, as we knew there was an epidemic of loneliness, as we knew what the research was showing us, I started to put together pretty slowly a list of things that people could do to make that connection out in the community. That list increased exponentially in a very short period of time. So what I want to do is not be academic about this. I want to be very practical and just show you that what I did was I created 5 categories. There are many more, but I'm just going to talk about 5. I'm going to talk about them briefly. See if these tickle you. See if there's something about this that says, oh, that's an idea I want to build on. Okay, you don't have to write it all down. Just think about it. So the 5 categories that I'm going to talk about today are social and support groups, education, teaching, working, and volunteering, as I've already talked about a little. Next slide, please. So the first thing is to look for an existing group who has something in common. They may have a common need, they may have a common interest. Maybe you have an interest and you find people with that interest. Maybe the group already exists, or maybe you go out and find 3 people who really want to read a book by Alice Hoffman, and now you have a group, a book group, right? Or you go to the rec center and you join a swim group there. You look for social groups who are interested maybe in any number of things. I'll make it up. Maybe they're just interested in getting the vote out and having lunch to talk about it. Join existing or create social groups. Go to rec centers. In our area, we have centrally located groups that cross a lot of T's. Always things like the Ys and rec centers, and we have a lot. We know people are interested because not in how to do these things virtually. Anything you can do these same sorts of things virtually. You have to do a little research to find out where they are. But back in the beginning of the pandemic, everybody I knew was using houseparty.com. Never heard of it before then. And suddenly we were having every Friday night with a cup of coffee in our hands, talking to people all over the country and staying connected. The last thing on this list is a support group, and I want to point that out because they can be very, very important, particularly if you're a care provider or you're living with a particular difficulty, a particular disability or illness. Support groups are social groups, but they're built around providing community for people who have some concern in common. Next slide, please. Always doing educational activities has the advantage of challenging your brain. That's awfully important. Sometimes they're active, so they challenge your body. And if you're very careful, the educational activities you choose also includes open conversation with other people, not just watching a videotape, not just watching a lecture online, but actually communicating, sharing ideas. Now you have a social activity. You meet somebody who's interested in the same thing you might be interested in. You form relationships.
And Cheryl, not to interrupt, we have 5 minutes till we're at 1:30.
Right, and thank you. And I'm just going to leave this up here for you to see. Next slide. Of course, you don't have to just be educated. You can teach other people, right? So just take an inventory. What do I do well that I'd like to share with other people? And you can do this virtually, or you can do it online. You can go to a rec center or to a senior center and say, hey, I'm really interested in helping people learn how to do woodwork. There's connections there once you start that class. Your skills involved, but so are people. Next slide, please. Many, many people want to work. I'm not going to say much about this, but retired people are working at very high rates these days, high percentages of people. So you can work online. You can, when you're not socializing much usually, but part-time jobs can be a very effective way to challenge your brain, challenge your body, and socialize. Next one. And of course, I've already mentioned volunteering is an opportunity to do for somebody else, at the same time you do with other people. AARP, Alzheimer's.org, there's a whole list right here. Take a fast look. I think you may be getting the slide anyway.
Yes, yes.
And just go past this one. It's going to pop up slowly. I forgot to take the animations off. Lots of other things you can do. Advocacy is one of my favorites. Next slide. Here's the trick in my mind. The trick is to, as Rebecca said, noticing what's going on, noticing you need to increase your activities, and then starting with something, giving it a try and congratulating yourself when you do reach out to do something new, or you help your loved one reach out to do something new. And that's about it.
That is excellent. I think this gives people a clear idea of where they could go to find ways or find places and ways to socialize and combat isolation and loneliness. And ladies and gentlemen, we will be sending out all of these slides. It is now 1:27, which gives us time maybe for for one question. And then what I'd like to do before that time though, Cheryl, Megan, and Rebecca, can you all give your final short statement for the audience? So Cheryl, we'll start with you.
Yeah, I'll start. I am very much an empowerment person. I think it's awfully important that you notice what you need and then you do something about it. And if it's hard to do, take a deep breath, try something, and then congratulate yourself for trying. The socializing is incredibly important for your body and your brain.
Thank you, Cheryl. Megan?
Yes. So as someone who has suffered from loneliness, can y'all see me? Okay. As someone who has suffered from loneliness, I just want you to know that you are not alone. I think that's the biggest, sorry, I've got this big thing on my screen. That's the biggest takeaway that I want you to have, is that you're just not alone. There are other people experiencing this, and there are small incremental ways in which to get out of it. And I want you to know that for the people that you care about too, who might be also experiencing this.
Right. Rebecca?
First, I want to point out we ran out of time, but I did put some of the resources I was going to share into the chat, so you can get the division's website and also information about the All Ages, All Stages initiative. But my final parting words, I would say, comes from a passion for advocacy. You all have enormous voting power in North Carolina. You're, among you are the biggest voting bloc. And so if this is an issue that you think is important, talk to your elected people and support senior centers, ask for, the General Assembly or your representatives to, put their monies where their mouth is and focus on older adults, and also services specifically to help older adults stay engaged.
Let me unmute. Thank you so much, ladies, for your comments today, your just valuable information for our audience. And audience, we will be sharing, we've got some great comments in the chat. We will take all of this information, make sure that we place it in the follow-up email along with a survey that we would like for you to fill out. I don't know, Patty, if you have the link to the survey that you can quickly post. If you do it from here, then when you get with the email, it will also have the link there so that you can take advantage of the survey. That will help us to provide these kinds of programs to you and know what you would like to hear and see. But I can't thank enough our panelists, Dr. Megan Smith, Dr. Cheryl Greenberg, and Ms. Rebecca Freeman for taking their time and to prepare for this presentation to share with you all. And we will make sure that the information is out in the next couple of days or so that you can take advantage of it. There was a question in the chat about whether or not you could share this. Yes, we need to get the information out. And that is one reason why we wanted to provide this session. Does anyone have a burning question? We might can stay a couple of minutes over it. If you do, let me take Rebecca off so that she won't feel like she's just spotlighted. If you do, if you could raise your hand or unmute and yell out, that might be best because there are quite a number of people on the call. Then let me know. I'm not sure why I am blinking. Faye Wilson's, but I'm not sure what's happening. Does anyone have a burning question? All right, if not,
was
ladies,
just a
do you
great
have any
session.
extra thing? Do you see somebody? Barbara Ward, Avard?
Yep, thank you. Got my name right. Hey, this was just a great session. I hope you'll do more. And my question was about sharing the slides. So thank you for giving us the ability to do that because I can see my church doing a lunch and learn similar to this. I think most churches these days, their congregations are definitely aging. So
Yeah.
this will be a great resource. Thank you.
Thank you. And maybe the ladies here might want to do it for you. So you may be able to contact them for presenting to your church or wherever your organization. We'll give you some contact information as well.
Will do. Thank you again.
All right, you're welcome. Anyone else? Before we close, I just appreciate all of you coming, staying on for this topic. And I wanted to make one comment. Megan put in the chat that service is a great way to help combat loneliness and isolation. And I don't know if any of you are on this call, but we had a great response to our Meals on Wheels, and people just responded back that they really thoroughly enjoy getting out. So doing something like that, going out to volunteer, is really a good way to help combat loneliness and isolation. So let's see. I don't see, and somebody put in senior centers and Meals on Wheels always need volunteers. So that is a great way to start to combat this loneliness and isolation that's occurring amongst so many of us. So thank you so very much. We really appreciate it. And from the bottom of my heart, I thank Megan, Cheryl, and Rebecca for your time and your efforts and all the invaluable information that you shared this afternoon. So thank you. Someone put church volunteer and libraries. We're just getting a lot of helpful information. We'll try to get that out to you.
Thank you.
Thank you.
Thank you, everybody.
Everyone have a great afternoon.
See you next time.
All righty. Yes, watch for the other lunch and learns that we
Yes.
will be providing.
Okay, bye-bye.
Bye-bye.